How can we restore agency for physicians for the profession of medicine? That's what we're talking about today. If you're a doctor, healthcare leader, or patient, you belong here. I'm Kim Downey, and this is Stand Up for Doctors Conversations at the Intersection of Connection, Courage, and the Future of Healthcare. And by way of a very brief introduction, Dr. Scott Berman is a psychiatrist here in Connecticut, and Dr. Marco Fernandez is an anesthesiologist in Chicago. And you'll both be coming to our physician retreat, and I'm so excited about that. So I had you on together so we can talk about how you've both experienced challenges navigating practicing in the system, and you're both still practicing medicine. So thank you very much. We need doctors. And we'll be discussing physician advocacy during our retreat weekend and how we can restore agency for physicians and for the profession of medicine. And after you introduce yourselves, I'd love to hear your perspectives. Marco is president for the Association of Independent Medicine, and Scott with all of the changes he's borne witness to spanning his decades of practice. So, Marco, what would you like us to know about you?
Yes, I am one of the founders and president of the Association for Independent Medicine. I was the president of Midwest Anesthesia Partners. I stepped down this year, so I was president for 5 years. We were the largest independent anesthesia group in Illinois. Before the pandemic, we were close to 300 members. Now we're less than 100. And we originally started with 8 groups. Now we're down to 3. We've had run-ins with private equity staff, backing companies, and hospital employment. Um, Eventually, my number came up and I was terminated from my hospital position, but the most of us stood in solidarity, pivoted, and created a new independent group. And now I'm trying to do as much advocacy work as I can on Capitol Hill, locally, and then answer calls to action wherever I can.
Yes, and thank you for your work. We need
Thank you.
anesthesiologists for sure. And Scott, what would you like us to know about you?
Well, I've been doing this a long time since finished residency in 1989. I had somewhere around the year 2000, I acquired chronic inflammatory demyelinating polyneuropathy. Ended up in a walker in a wheelchair, and that caused many problems with employment, including becoming unemployed. I had 13 years when I just wasn't well enough to work. Went back, and now I'm at a federally qualified health clinic, Wheeler Clinic here in Connecticut, where if I'd been treated this well for the last 40 years, I'd probably still have a head of hair. So,
What's Marco's excuse? No, kidding. Yeah, I love that. So you've had, what some people might consider insurmountable obstacles, but it was surmountable. And I love how you're both sharing, that there's always a path forward, right, for each of you. And Marco, would you like to share a powerful story?
Well, I think one of the things that I had mentioned to you before was this became a burning platform for me only because I dealt with issues on the patient side with my mom when she passed away a few years ago from cancer. I really thought that as a physician, I'd be able to navigate the healthcare system, and at least I would be able to make sure that she didn't suffer. But I was wrong. I think, we went into it and she had great physicians. She stayed at my hospital, but she wasn't well taken care of. And it was because there wasn't enough nurses. And I didn't take that into account. I think it's just a symptom of all the problems that we have in healthcare. So I decided that I was going to do everything possible as long as I could to try to address the issues, and more so to try to help physicians stay independent, because I think that we have more skin in the game. We're able to direct the care how we see fit as opposed to following any kind of metrics or any bottom line. We're going to do what we think is best for the patient. And she inspired me, and I wish she was here with us today, but I'm going to continue the fight only because now I worry about my wife, myself, my kids. We're all patients on the other side of this.
Yeah, that's for sure. And again, I'm so sorry that you had that experience and how frustrating it is as a physician, maybe especially where you think you'd be able to navigate some of these things. But if there's not enough help out there, or the nursing staff, there's only so much you can do, and it's frustrating. But your work is very inspiring. And Scott, would you like to share a little more of your story?
Yeah, I mean, parts of it, after I got ill, I was hard to keep up at work. And then the next part is just a bleep because there's an NDA about what happened to me um, from the hospital that decided not to continue with me. And then I couldn't practice for a few years. Then I was too sick to get out of bed for just CIDP can cause immense weakness and fatigue. Then I got better for no particular reason. I wasn't getting any treatment. I had failed all the treatments over 13 years, but I started to simply regain my energy. I went to a physician health program in Pennsylvania, which actually treated me nicely. They have a bad reputation, but it probably treated me nicely because it was a physical illness, meaning they stigmatize people with addiction and mental illness, but physical. I still had to do neuropsych testing and boards again, and patient simulations and a month of unpaid internship, and then I went back. I've been doing community health for 10 years. And it's pretty bad out there, not only in general, but for doctors, there's not a lot. I've actually made a Google Doc of some resources I'll send to you later on, but there's not as much as we ought to have.
Yes, I would love that because I want to put a page on my website of resources for physicians. And I've had some doctors come on to talk about PHPs because a couple doctors have had very good experiences with them, as you're alluding to. And, some other doctors not so much. And it's hard because I guess it's by state, right? So it's hard.
Yes.
So you really have to find out like the one in the state that you'd be participating in and find more about that.
Yeah.
Yeah, right. So Marco, the week before our conference, you're having a conference. Would you like to tell us about it?
Yes, we're having our inaugural Independent Physician Summit here in Chicago, August 2 through 4. We got to a point where I had been to many conferences, given lots of talks, been on Capitol Hill maybe a dozen times. Uh, I was asked to participate in panels at the National Press Club dealing with uh, corporate consolidation in healthcare and vertical integration. We got to a point where we decided it was time to have our own conference. One of the things that I do want to be able to do at the conference is educate physicians on how we got here. What economic policy led to the decisions over the past 40 years to give us what we have now that allowed this consolidation and allowed insurance companies to own the doctors, own the PBMs, and still be able to dictate insurance prices. I think that if we're able to understand more of how we got here, I think our strategy might be a little different.
Yeah, absolutely. Understanding the history is very important, and we'll give a shout out to Dr. Adrian Towson, who will be traveling from yours, and then you'll both come to ours. So I'm excited for that. And we're going to have some easel paper, and I'm going to have one page up that's kind of like a message board. When you were in college and would write on the college dorm room doors. So what I'm thinking is one of the afternoons, while you're here, is we could say, hey, if anybody wants to join you for lunch to hear, more specifically about, what came of your conference. And we'll also have downtime after lunch and before meals for people to break off into groups to talk about whatever they want. So I'm excited to find out what comes from that. And Scott, tell us a little more about how you've managed, with all the changes that you've seen these days, and what do you think we need to do to restore agency for physicians in the profession of medicine?
We'll get some agency back. Doctors historically have not been able to organize much. I don't know two doctors over the last 40 years who were close friends or got along, and that's a problem. My work, I'm not doing any political advocacy. My work is, kind of micro guerrilla work. I train residents and nurse practice residents. When we send people to the emergency room, it's common for the emergency room to send them out because the patient said, I'm not suicidal at this time. And then train the residents, you're going to call the emergency room and say, this person has the following risk factors and all these things. They need to be hospitalized. If you don't want to do it, don't. But I'm documenting what we said. And we have to have fairly brusque conversations with a lot of people because they just don't want to do. Because the insurance company said if you're not threatening suicide, you're not suicidal, and there's no truth to that. So we do a lot of individual advocacy for patients, and it's miserable. My worst fantasy or my worst part of the day is the hour I spend online with a peer-to-peer insurance company.
Mm-hmm. Now, anesthesiologists, maybe if you're in pain medicine, but if you're in a traditional hospital setting, you don't necessarily have to do the peer to peer, do you, Marco?
What we do if we're pre-oping patients, then we have to, if it's a complicated patient and a high risk surgery, then we do reach out to the specialist or whoever's taking care of the patient to try to figure out how to optimize the patients before surgery. But on a regular basis, no.
Uh-huh.
Marco, we had a Connecticut-based insurance company about a year or two ago try to put through something. Insurance companies are here in Connecticut locally that they would limit the number of minutes somebody could stay under anesthesia.
Yes, yes,
We
yes.
heard
That
about
was, yes. Last year they were trying to pass that, and here in Illinois, after that we kind of passed a law. One of our fellow anesthesiologists, who also is an assemblyman, made sure that that would never come up again. Yeah,
Good, good, yeah.
we have no control over it. I have no idea who would think of trying to limit uh, the compensating an anesthesiologist only a limited number of time for any kind of procedure.
Yeah. Yeah, they step back, but they keep doing stuff like that, and it's pretty miserable.
that was
Yeah, I mean
ridiculous and crazy and dangerous. Go ahead, Marco.
when it comes to advocacy, we're outnumbered, we're outspent, and I'm hoping that we're able to realize that we have more power than we think. It's just a matter of however you can support whatever organization is trying to make a difference. I'm connected with lots of grassroots groups, and I'm slowly starting to get more and more involved with the American Medical Association. They're the 800-pound gorilla in the room, but I think that there are certain things that they're addressing. They're very good at addressing. They have their agenda and what they need to do, and I think they address a lot of the symptoms, whereas we're trying to see if we can address the causes by partnering with consumer protection groups, by partnering with health policy advisors, health policy experts. We are going to have someone, we last minute, we got a speaker coming from Harvard who is actually part of implementing the health legislation in Massachusetts, then went to DC and helped put up the Affordable Care Act. So he had all that experience, and he's coming out with a book next week that kind of really talks about what really happened and what went wrong when they implemented the Affordable Care Act, which led to a lot of issues that we have now. I think there was a lot of unintended consequences that happened from that, and now we're trying to figure out how do we change it, and how do we get back to that physician-patient relationship without having any kind of corporate interference.
That's so important. Scott, does that bring up anything for you?
Yeah, again, I'm not. Maybe at the conference, I will get involved at a more government level. But for us, psychiatry in a community-funded, federally qualified health clinic is all about social determinants. So we're constantly telling the residents, put your prescription pad down. You ask somebody who's lost their appetite, and the resident said, should I give them this medicine that also increases appetite? And I said, what do you eat? And she said, the food at the shelter has stomach I can't eat. We gave her a gift card. So really, where things went wrong socially is where we start. And it's so frustrating. It's really heartbreaking to see how many barriers there are.
Mm-hmm. Yeah, for sure. So, from your perspective, what do you think we could or should be doing?
You know, I don't know. I'm going to have to defer to Marco. I mean, I fight every day, and I try and tell the residents and the nurses, don't sleep with the enemy. Just because the insurance company wants it, you can't put that in a chart. You have to document what they actually need. But I come from a generation and a time when we didn't have more autonomy back then, by the way. Quality and the quality control and the risk reviewers and the insurance companies were always involved in the 1980s. We just never had a model of fighting back.
Hmm.
I agree. I think that's one of the hurdles. I don't have answers to a lot of the problems that we have now, but my whole thing is that we need to really come together. Physicians are so siloed, as you said earlier. We have not done a good job of organizing. So many organizations are jockeying for a position to build a brand or build their membership, when we should be trying to work together as much as possible. I think as a collective, we would be pretty impactful if we were just to not politicize issues and realize we're all fighting for the same thing. We just really have to come together and come up with a list of priorities that are going to benefit everyone. And I know, and it starts with just knowing the history. If you know the history, then you can try to plot some kind of strategy. If we've had a lot of discussions with the AMA leadership, and I think they're slowly starting to pay attention to what's going on from an economic policy standpoint. And I think that's very important to try to figure out what's the best step to move forward.
Hmm. Yeah, I think that's very, very important. And I've heard recently talk about doctors unionizing, and some people feel strongly on one side of the fence or the other side of the fence. I was wondering, Scott and then Marco, do you have opinions on doctors unionizing?
I'm very pro-union. My grandmother worked for the International Ladies Garment Workers Union, and my grandfather was a socialist who fled Poland. So I'm pro-labor, pro-union. Um, uh, I think that the way they get us all the time is, well, you can't not take care of people. You can't strike. You can't do something because the patient would suffer, which is what they do to teachers too. You can't walk out because your kids would suffer. Uh, People are already suffering. I think we need to take some action.
Hmm. What's your opinion, Marco?
I I agree. I am pro organizing, pro union. I think one of the pillars for the current economic model is to prevent organizing. That's how you keep control. That, along with deregulation and wage suppression, that's pretty much the foundation of how these companies came into power. I believe we're in a second Gilded Age, where before you had the railroads, big oil, steel. Now you have tech, pharma, and you have the hospital systems and the payers. The payers. I mean, that's huge. And how did we get past the first Gilded Age? We organized. So we really have to come together. And unfortunately, I I hate to think that a group got to a point where the only option they have is unionizing. It's a long slide from you losing your independence to unionizing, and the ones who suffer are the physicians, the nurses, and the patients. By the time you get to a point where now you've unionized, and I agree, you have to empower yourself however you can so that you can appropriately take care of your patients and take care of yourself.
Mm-hmm. Yeah. So, Scott, you're still practicing with all the struggles of medicine today. What keeps you going?
I love doing it. Now I'm in a good place now with a supportive directors and a great medical director and and reasonable supports and half an hour per patient. And it's a great, and I'm teaching, it's ARPR residents, but they're residents. It's a great pleasure. And the job's always a great pleasure. People don't burn out because of their job. They burn out because of insurance companies, hospitals, and electronic medical records. I'm in an FQHC. I get some buffering from some of that. I basically see patients, and my directors and boss, God love them, shield me from all that, everything else.
I love that because we need to know, what's going well and what could be replicated and amplified. Is there things that are going on, near you that we should take to heart and replicate and amplify?
I mean, again, what I say is community health. People might think of it as kind of a gritty whatever deal, but there's reasonable compensation, lots of positives, lots of emotional satisfaction. I think that there's a big need for people in community health settings, and maybe finding out that maybe you're not paid as much as you are in a private practice, but you're not paid by the hour of the patient. They just pay you and let you do your thing. It's a nice lifestyle.
Hmm. That's good because I love to hear about happy doctors because,
Yeah.
like I said earlier, we need doctors. So, Marco, what keeps you going?
As Scott said, patience and the work that we do. Once I lost my job at the hospital, I was kind of relieved because the pressure for production wasn't there anymore. And then we were able to build our practice however we wanted to. Luckily, we already had Plan B in our back pocket, and we already knew what was going on with the market. We were able to grow our sites of care. We doubled in a couple of months, and we want to be part of the community. We want to help surgical centers grow not only their centers in terms of what they do, but the quality and help build centers of excellence. And we don't chase the dollars. That's part of our culture. We love each other, we trust each other, we respect each other. We were never about chasing the money. Otherwise, the group would have disbanded and everyone would have gone their way. But they trusted what we were trying to do, and no one has left our group. And we're hiring and we're growing, and I couldn't ask for anything more. And then I do advocacy as my side gig.
Yeah, right. In your spare time, right? So I love
Yes,
that you feel like it can be replicated and amplified, what your practice is doing.
yes. Yes, the other arm of Association for Independent Medicine, which is run by Jack Dillon, he's our MBA. He's the one that helps with the nuts and bolts of running a practice, governance, contracting. So we're trying to let people know you have a choice, and we're here to help you however we can. And I think that's one of the things that folks don't always, or they're not always aware of, that you can talk to someone. It's not going to cost you anything. Before you sign any kind of contract, you should really find out what people are doing and if that's really what you should be doing, or if there's any other options for you. It all depends on what you're looking for, and every market is different, and the needs of every individual are different. But we're trying to cast a very wide net, and if you're interested in staying independent, we can definitely help.
Hmm. Yeah, that's great because so many practices that were independent have ended up being, bought out by larger systems. Um,
Right.
were you going to say something, Scott?
Go ahead.
Oh, well, I was going to say, speaking to silos, right? And you're saying like lots of times doctors end up being siloed for various reasons. That's one thing that I love about our retreat is we have doctors so far coming from representing 16 specialties, 20 states in the United States, Australia, London, and a doctor, actually anesthesiologist who's in Italy, is planning on registering next week. So we have a few
Wow.
anesthesiologists represented, a few psychiatrists represented, like I said, and also from like earliest career to into the 70s, into their later career. So I love that we're bringing all of these doctors together, and the topics will be about things that doctors want to hear about, but it's no boring lectures. The doctors will talk for 10 to 15 minutes, but then it's all small group discussion to relate it to your own life or how each of you have dealt with these challenges to support your peers. And then we have the activities that help you use a different part of your brain, so those are going to be equally as well. But like I said, that whole what's the beautiful part of our this Sunday morning is when we call this question, how can we restore agency for physicians and for the profession of medicine? It's the doctors there that are going to decide what they want to talk about. And as many topics, whatever that brings to mind for the doctors there, they can raise their hand and we'll write it down. And then whatever number of topics you guys want to talk about, that's how many tables we'll break into. And then there's this thing called the law of 2 feet. We're basing it on open space technology. So you can move around to different tables, come and go. We'll take a break, do it again, and then wind up with what could we do, what should we do, action steps. So there could be some catalyst groups that come from this, people that can continue the conversation. So I feel like the retreat won't be the beginning or the end. It'll be the middle because we're also having a couple virtual fireside chats coming up that I'll message you about. So if people want to hop on a Zoom and meet ahead of time, and you'll all know a friend, and now you know each other.
Good. Wonderful. That's great.
Fantastic.
Yeah. So Scott, was there anything else you wanted to share with us? Let us know about you or your work or messages for your physician colleagues.
You know, you said have a positive action message at the end, and I thought about it. Couldn't come up with a positive, so I have two negatives instead.
Okay.
Uh, don't be an afterthought in your own life, and don't listen to people who tell you should do more self-care. That just triggers the doctors do it all by yourself reflex. Find people in your life who provide substantive care, psychiatrists, tennis coaches, house cleaners, psychics, whatever, and get the same care that you give to other people.
I love that. That's great. And I feel like what you said is important to note because you don't go shouting self care to people who need community care, right? And it's the same reason doctors don't like the word resilience because they'll say, we're some of the most resilient people on the planet, which you are, and that the system is the problem, right? It's that but simultaneously, or I should say, and not but, right? There are things that individual physicians can do to resource themselves and should do, right? So while we're trying to make these broader changes, and that's what we're going to be talking about and what we've talked about today, is in the meantime, you still need to live and you still need to take care of yourself. So you can look at it both ways, right?
Absolutely.
Yeah, yeah. Marco, is there anything else you'd like us to know about you and your work?
No, I think one of the things that I learned early on was to embrace change. And I don't think I would have survived a lot of things if I hadn't changed my mindset through talking to people, through reading, just to accept the change, embrace it, and then come up with new ideas on how to deal with it and how to help others.
Embrace change. That is a really good one because a lot of us think we're in control, right? Or we try to control things. And then when things happen in each of your own lives, right, that you didn't have control over, you can just stay low, feeling low, and wish that things were different, or you can figure out how you can embrace the change and move forward. And I think you're both really inspiring examples of that. So thank you.
Thank you.
Thank you.
You're welcome. And thanks again for being my guest. And thanks to our listeners for being part of our Stand Up for Doctors Global Neighborhood, a place where physicians and those who care about them can connect, empower, recharge, and celebrate. You'll find more stories like this in our White Coats book series. And if you're a doctor, would love to welcome you to our inaugural physician retreat this October, where these conversations will continue in person. Would be honored to have you join us. And if you'd like to help sustain this podcast, please consider sponsoring an episode or connecting us with a mission aligned sponsor. Links are in the show notes, including how to reach out to our guests. And in closing, to move the needle in healthcare, we all need to raise our voices and we all need to care about each other. We already know that doctors need to care about patients. Patients need to care about doctors too. So stand up, doctors, and let's stand up. So stand up, doctors, and let's stand up for doctors.